Thank you so much, and it's fantastic to be here. What an amazing day. You've done such a brilliant job pulling it all together. I am the last speaker, you'll be so pleased to hear. And yeah, your heart probably sank when you heard I was going to talk about another framework, system, structure. But I will try and make it colourful and engaging for you. And possibly I can do it in less than 25 minutes, if that would be helpful. I'll see how it goes. Famous last words. So my name's Jane Willis. I am an independent creative health consultant. I've been working in this amazing sector for the past 30-something years. And it's just always so life-affirming to hear about the work that you're all doing, that we're all engaged in. What I do now as an independent consultant, I suppose, is I like to think that what I do is support the people working in this sector to practice well by facilitating creative approaches to reflection, learning, and evaluation. And I've been interested and doing a lot of work around evaluation for many years now. And through that work, I got really curious about quality. What is it? In the creative health sector, you know, what is it? We all do different things in different ways with different people in different contexts. So what does quality mean to us? And it made me realize that it's a really relative concept. You know, good for whom, good for what, good for where, good for what reason. If you want to buzz around town, a Mini is a really good car. It's a great car to have. If you want to go off-road and you've got a family of 6 children and 2 dogs, then, you know, it's not going to work for you at all. A Land Rover might be better, for example. So in terms of quality of car, which car is the best quality car? You know, it's all relative. It's all about horses for courses. It's all about who you are, what you're doing, what you're trying to do. So that led me to approach the Culture, Health and Wellbeing Alliance and make this slightly mad proposal that we should try and co-create a quality framework for the sector. So what I'd like to do this afternoon is to just introduce you to that framework and hopefully inspire you to take another look at it and maybe encourage you to think that it is something that you can use as a tool to support your practice wherever you are in your practice, whether you're a health partner, a creative practitioner, whether you're early career or whether you've got many years experience behind you. So, great. Yes. So I suppose my first point that I want to make is this thing about the creative health quality framework is not trying to mandate to you what good looks like. It's not saying, here's a framework and you've got to fit your practice into this framework. It's about trying to develop a consensus around what good looks like in terms of supporting creative health projects, in terms of supporting arts, creative, cultural projects that support health and well-being. And that consensus of what good looks like needs to be spacious, it needs to be flexible. We all need to be able to interact with it in different ways. So the Creative Health Quality Framework is intended for everyone involved in developing and delivering creative health projects. Everyone. So it's aimed not just at practitioners or creative health organisations or community organisations delivering work. It's aimed at the health partners that you're working with and alongside. It's aimed at funders, policymakers, commissioners. Because above all, as we've heard through the many examples, this work is about partnership work. None of us can work in isolation. We are all working in partnership. So the framework is for everyone, and it's underpinned by the concept that quality, we all have a shared responsibility for quality. So the idea of trying to develop consensus around what good looks like is so that we can talk to each other around that, so that we can discuss it together with partners. What does good mean to you? What does good look like to you? How can we work together to get consensus so that we're all working towards the same aims? And if we do that, it's really underpinned by the belief that a shared concept of quality, a real clear vision around what quality looks like will mean the best possible outcomes for everyone. So definitely the best possible outcomes in terms of health outcomes for participants and the people that we work with, but also the best outcomes for practitioners. It's about the sustainability and well-being of the people working in the sector as well as the people that we're working with. So that's that thinking about why this is important, why we decided to develop it. In terms of how it was developed, it was a collaborative process. It was a process that I led in partnership with the Culture, Health and Wellbeing Alliance. It was an 18-month process supported by an amazing steering group of people with a wide background of experience and skills who were able to support and give us feedback on iterations along the way, but also a wider reference group who were able to kind of plug us into policy and think about how to disseminate the framework. But there were more than 200 people working in the sector involved through a whole series of engagement workshops, and some of you, I'm sure, might have come to one or more of those. The framework was launched in September of last year, but it's not the end of the story yet by any means. It's currently being evaluated in practice, and we hope at the end of the evaluation to be able to review not just is it useful, does it help, but also how is it accessible, how could we improve it, what's missing, what help do you need to put it into practice. So we hope to review that in, I think, about 8 months' time, and there may be a quality framework version 2 at the end of that. I don't know, we shall see. So what does it look like? Well, it's actually a suite of documents, and I attempted to print them out and bring them with me to just kind of show you, but I, of course, don't have a colour printer, so they don't look very engaging from my black and white printer, because, of course, the whole thing is colourful and well designed by the amazing Jenny Ives. So if you go to the Culture, Health and Wellbeing Alliance website, you can download all of the documents. The main document is this one, a Quality Health Framework, and it's about 40 pages long, but they're very accessible pages. And everything that you need is in this one single document. So if you want one big download, that's the document for you. But then we've tried to create other kind of bite-sized documents that you might use too. So the place I recommend everybody starting from is this, and you've got a printout on your tables. This is just a poster showing the quality principles that underpin the whole framework. But within the suite of documents, there are also recommendations for different stakeholder groups. There's a spreadsheet that shows how to apply the principles to practice. There's a sheet of tips on how to use the principles to support partnership and collaboration in terms of developing and delivering projects. And there's also a sheet of links to further resources. So what I thought I would do is just take you through all of that slowly to convince you that it's not overwhelming. So let's start with the principles, shall we? So in some ways, I think you could just have your principles poster up on your desk, up on the wall next to your desk, and there's enough here to keep you thinking for quite a long while. And I say that because that's been my experience of working with these principles. The more I've worked with them, the more they've helped me reflect on the way I work, on my practice. They've helped me think, well, actually, shouldn't I be doing that in partnership or collaboration? Who could I work with? How could I do that differently? Or as a freelance practitioner, the other one is, Jane, is that realistic? Can you really do that in that time for that budget? Just think before you say yes. So the principles, they're just a really useful aid memoir. The 8 quality principles are the foundation of the Quality Health Framework, and they were co-produced through that whole process of working with the steering group and the wider sector. These are the principles on which everybody felt the work of this sector is really based. They're the values that underpin the way that we work. And so they are person-centred, So doing things with, not to, valuing lived experience, enabling participants' potential. It's all about people, not patients. It's all about the whole person, not just the health condition. So person-centered. Equitable. Very much about working towards social justice, working towards a more just and equal society. So whether that's through tackling social inequalities or health inequalities, or whether that's just through thinking about accessibility in terms of the way in which you develop and set up programs. You know, who has access to them? What are the barriers to participation? How can we make this work more equitable? Safe. Absolutely safe. Do no harm. How do we ensure safety? How do we manage risk in this work? Because it does have the potential to do harm as well as good. We need to think about how we manage that, how we mitigate against it. Creative. At the heart of everything, creativity. But also, how can we use creativity to engage, to inspire, and to ignite change, whatever that looks like? Collaborative. We've heard again and again and again throughout the day how fundamentally important it is to work in partnership, not to work in silos, not to work in isolation, not to have sporadic projects separate from each other, but really to find ways to work with others in a joined-up way so we maximize experience, skills, resources, all the things that we have at our disposal. Realistic. This was something through the process of development came through loud and clear, that if as a sector, the creative health sector is to be sustainable, we need to be realistic. We have very little time, we have few resources, we have meager funding, we can do a lot with what we have, but we have to be realistic. Otherwise, as organisations and practitioners, we will burn out. So how do we ensure that realism is built into what we do and the way that we work? There's one close to my heart, reflective. How can we embed reflection in the way that we work? How can we make sure that we are always reflecting and thinking and learning and putting that learning into practice, whether it's through research and evaluation or whether it's through supervision or reflective practice, or just thinking about what we're learning as we practice. How do we use that to develop and grow and learn? And lastly, but absolutely not least, is sustainable. So this is a big one. This catches a lot of different things under one word as an umbrella. So work towards positive long-term legacy for both people and planet. So sustainable in the sense of if we're supporting people's health and well-being, how do we do that in a way that's sustainable and long-term? Not a project that helps them for a few months and then leaves them high and dry. How do we build in legacy, follow-on groups? How do we build community so that we're building a sustainable infrastructure to support people's flourishing in the long term? But also, how do we build sustainability into our own practices and our organisations so that we don't disappear, so that we're here for the long term, so that the relationships, the partnerships that we build up also sustain? So I don't know if you've noticed, but with all of the principles, what happens is none of them exist in isolation. They're actually all very closely linked to each other. We can't be sustainable if we're not realistic. We can't be, I'm trying to think, I can't think off the top of my head how they all fit together. But what you'll find is if you're trying to improve one, you'll have to kind of work with all of them together because they all work to support each other. And so can you see now why I say, if you just want to start in one place, my message always is start small. Do one thing, do it really well. Do less and do it better. So if you want one place to start with the quality framework, just start with the principles and think about what they mean to you, what they mean to your practice, what they mean to your organisation. But the framework goes on to look at what those principles might mean to different stakeholder groups. We are considering 3 stakeholder groups here in particular. it doesn't necessarily mean it captures everybody involved in this work, because so many people are involved in the work. But in particular, we're considering policymakers, commissioners and funders. We're considering creative health organisations and their partners, whether those are health partners, community-based partners, and we're thinking creative practitioners. So we've come up with a set of recommendations for each of those stakeholder groups in terms of how they might think about putting each of the principles into practice, what it might mean for funders, what it might mean for practitioners. And so as you read through the framework, you can either read each principle and how it translates to the different stakeholder groups, or you can read a specific set of recommendations. So again, if you're a funder, you might just want to look at your recommendations. If you're a practitioner, you can jump straight to your recommendations. So you've got the 8 principles, you've got recommendations for the different stakeholders. We then looked at how those principles might be applied to practice, how they might actually show up when you're planning, developing, delivering your creative health practice. And we've used a model here of thinking about practice as a quality cycle. So quality isn't something that you think about at the beginning and then you never think about again. It's something that you need to be thinking about and embedding all the way through the whole process of developing your creative health projects. So we've divided that process into 5 phases. So the first one, developing your idea, coming up with the concept of what it is you're going to do, the proposal, the aims, the approach you're going to take. So at that stage, when you're thinking of what are we doing, who are we doing it for, why are we doing it, what's the need that it's meeting, all the time it's encouraging you to think, well, what does person-centred mean here? What does equitable mean? What might safe look like? How do we ensure that creativity is at the heart? That's the first stage, developing your idea. The second stage we've called building strong foundations. And that's really about making sure that you've got the infrastructure in place to support the delivery of the idea. So that might be around, have you got the appropriate policies, safeguarding, for example, or processes. If you're employing freelance artists, are you briefing them? Are you supporting them? Are they getting an induction to the project or the participant group? What about structures? What about governance? What about contracts? All those kinds of things that are the strong foundations of good practice in terms of the work. And then the third stage is making detailed plans. So once you've got a really clear idea of what you're doing and why you're doing it, you've got good foundations in place, then it's a question of, well, how are we going to do it? What are the timescales and what are the resources and how are we going to use those resources and how are we going to ensure safety or how are we going to put support in place for artists? All those kinds of things that need a lot of planning. And then there's delivering the work. Actually what happens in the room or in the space where the creative practitioner engages with participants, where the activity takes place. What do we need to be thinking about in that space where the activity happens? What does creative look like there? What does safe look like there? What does collaborative look like there? What does person-centred mean in the room where the activity is taking place? And then lastly, we've got learning from the work. So I've mentioned reflection and evaluation, but also how do we disseminate that learning? How do we put it into practice? How do we plough it into the way in which we think about the next project or the development of this project? And of course, all these things don't always happen in neat boxes. You know, evaluation is something that you need to plan at the very outset as part of the conception of the project, not just think about at the end. But the principles are mapped out against these stages. And so as you read through the framework, you can look at each one. So here, under developing your idea, it gives you some prompts to think about. So, for example, under person-centred, when you're thinking about the idea for the work, does the idea respond to people's needs? Has it been co-produced with people with lived experience? Is it responding to the needs of the whole person, not just to the illness or condition that they might have? And there are prompts like these for each of the quality principles at each stage of the development and delivery of the work. And I say prompts because they're not mandates. They're not, this is what you have to do. They're not tick off all these things and you'll have a good project. They're just prompts. Is it helpful for you to think about this? And the answer about whether it is helpful for you to think about it will really depend on you and your context and your project. You know, whether it's a service user-led project, a really small project, whether it's a big 3-year program, you know, whether you've got a tiny amount of resources and a team of one person, or, you know, whether you're working from an organization that has staff, all of these things will impact the way, what you can do, what's realistic, and what you can take on board. But the prompts are there just to spark thinking, reflection, learning. They're to help you think about not what do you have to do, but what's one small step you might want to take to develop, grow, or improve your practice. And all of those prompts are captured on a spreadsheet. Some people love them, some people hate them. We had some really interesting discussions in the steering group about spreadsheets. But all of the prompts are captured on a spreadsheet. So if it's helpful for you, you can use the spreadsheet, which is downloadable as a separate document. And you can either read across from left to right, so under collaborative, if you're particularly thinking, how can we build partnership, working, collaboration into our work, you could read across from left to right for a whole series of prompts to help you think about embedding collaboration. Or you can use it the other way, reading vertically from top to bottom. If you're at the very early stages of a project, what are the things you might be needing to think about at this stage? And lastly, and this is something that we're hoping to grow and develop, on the framework there are embedded links, and those links are available as a separate handout. So what we're trying to do is use the links as kind of signposting. So for example, one of the prompts under planning the work, I think, is around, you know, are you paying appropriate day rates for artists? So somebody might think, well, what are appropriate day rates? There's a link. You can click. It takes you to the Artists Union recommended day rates for artists. So you can immediately see at a glance what they are. Or there are other links to explain terms or to enable you to dig deeper if you want to delve, if you want to learn more. So as I said, it's being evaluated, and what we're hoping is that the resources and links will grow so that it becomes a sort of a hub for you from which you can find out more information. There are also, well, at the moment, there's probably one thing which I would call a tool, but this is something I'm hoping we can develop more of. And what the one kind of tool or provocation for using the framework that's in there at the moment is this one. It's called How to Use the Quality Principles to Support Collaboration. So it's just a list of, I think, 5 or 6 ideas for creative engagement activities using the principles as a way of, I suppose, enabling collaboration, opening up conversation and dialogue with partners. Somebody said earlier, you know, one of the challenges of this work is there are so many languages to learn. You know, there's the voluntary sector language, the health language, the arts language. So the idea here is that you can use these principles as a tool for dialogue and discussion. Well, what does person-centered mean to you? What does it mean to you? And what's really interesting about that is sometimes you hear very different perspectives on the same word from different people, depending on where they're sitting. So it's a really good way to cement partnerships and develop mutual understanding and a shared sense of priorities and aims and mission, and really helps you work together as you move forward in your projects. So that's a really rapid overview of the quality framework. I can't emphasize enough, it's a tool for you to use in whatever way is useful to you. I can't emphasize enough, but take one thing, find a starting point, think about what's a small step I could take. Don't feel that you have to take everything on in there. Take on what feels appropriate to you at whatever your stage of development is, or whatever the scale or context that you're working in. But I will just leave you with a couple of prompts for reflection then. So, 3 things. As I said, I really encourage you to start where you are. Start where you are and really think about those principles. Which are the ones that feel most familiar to you? Which are the ones that you know most well? Which are the ones that you embody in the way that you work, in your practice? Which are the ones for you to really celebrate and own? This is us. This is a central value for us. We really embody this in the way we work. Start close in and be honest. Which principles are least familiar? Which are you unsure of? Which would you like to develop or learn more about? And then start small. So, is there one small step you could take towards that? What would that be? So, thank you very much. I will be... I was just going to add that I will be around for the group discussions. So, if you want to take any of this further, I'm here.
Yeah. I don't know which one's speaking. Absolutely. I have to say, I have this up in my home office, and it really is quite helpful. Jane suggested it on a Zoom, so I did it. And then I've been project planning, going, how can I be more sustainable in this project? So it is really a good prompt to put this up somewhere you can see it.